We are back with Dr. Castelli, and we're learning about chronic knee pain and some choices that you have. So, Doctor, it's great to see you again.
Thank you.
Walk me through what you see day to day in this practice when it comes to knee pain, because a lot of people experience it. It is chronic, it's something that's daily, and for a lot of people, they've been fighting it for decades.
Oh yeah. I mean, it's very common. It's one of the most common causes of disability in the United States. And so having a solution like this is just awesome, because I do chiropractic care and physical therapy and things like that, and that does help. But what we have going on now with Kim running this knee program, that's been the game changer. It's been able to help a lot of people.
And we will catch up with her in just a little bit.
Yeah.
Walk me through the treatment, because obviously for everybody who walks in, it will look a little bit different depending on their background, their history, and what they're experiencing.
So there's a couple of key components to it. The imaging is very important. So we'll have real-time X-ray imaging. It's called fluoroscopy. So as she's doing an injection, she can see very specifically as she's doing it if the needle's in the right place. And it is painless, by the way. So everything's numbed down, because a lot of people get scared with needles, including myself. So painless and then very accurate. The studies show the efficacy is 33% better when we do the X-ray guided injection. So that's a big part of it. In addition to that, the specific products that we use, it calls for 5 injections, so a series of 5 per knee. And what that does, it actually helps stimulate, they're called synoviocytes. They're the cells in the knee that produce the synovial fluid. So it stimulates them to produce fluid to help cushion the knee and lubricate the knee. So long after you're sustaining those results and that relief. So that's a big difference.
At what point should a patient come to see you?
Yeah, I mean, if it's affecting your lifestyle, if it's keeping you from your day-to-day activities, even if like you're trying to be active and you're trying to exercise, walk, work out, it's worth a consult. I mean, there's no risk, there's no cost. We can come in, we can see, look at the imaging, and just see if you're a candidate for this, right? Because there are conditions where, no, this really isn't gonna apply, we'll refer out appropriately. But otherwise, if you're realizing, hey, I'm not doing this, or I'm hesitant to get down on the floor to do this with my kids or my grandkids, then it's definitely worth taking a look.
And then with what you're offering up now, does insurance cover it?
So yeah, actually it's great. I mean, Medicare and most insurances do cover this procedure. It's actually been around for a while, over 20 years, so it's approved, FDA approved. It's just not a lot of people are aware of it. And then there's a lot of, like I said, a lot of different approaches and products to it, and just our protocol is doing great. I mean, Kim will tell you, like the results that we're getting have been phenomenal.
All right, well, let's go talk to Kim. Right now, I'm with Kim Seals, and we're learning about what she sees on this side of the practice. So patients come in, and you will actually take a look at their knees through imaging, and from there, you can kind of dictate where they go.
I do a no-cost consultation where I do a history, complete history and physical exam, and then x-rays. And for example, if you look at this x-ray, you can see the space here. And many times that space gets smaller and smaller because of arthritis. And they go to an orthopedist and they say, well, you need surgery. And a lot of them are like, I don't want surgery.
So this is what's interesting. If you were told that you need surgery, a second opinion seems like a nice thing to do, right? And there's no cost with this.
Correct.
So it just kind of makes sense. Try this route first before someone cuts you open.
And I make it as painless as possible.
And I think it's important to say there are cases where you absolutely need surgery. However, this is a great route to explore just to make sure, like in this situation here.
That is correct.
And then a lot of times with treatment, it doesn't take that long for cases where they start to walk around and they don't have pain anymore.
Yeah, they notice that the stiffness is less and they're able to walk around, and some it's with 2 to 3, sometimes 5, but even afterwards, up to 90 days, it continues to improve.
Well, Kim, thanks again for your time and information.
Thank you.
We appreciate
Great
it.
to be here.
So it's pretty remarkable what Kim sees on her side of things, and I could see how you're leveraging different types of technology in order to get the best outcome. So if people want to learn more about the practice and set up an appointment, how can they do that?
You can go to the website, castellichiro.com. or just give us a call at 904-854-9353.
All right, and the next time we come out here, we'll talk to some of your patients. I know you have a lot of them that are
Yeah.
singing your praises, that are out running around, literally running around. Their knees are great.
They're doing great, yes.
Well, thanks again for your time and information. We appreciate it.